Norfolk. It seems hard to believe, but 2/3 of adults are at risk for heart disease. And do you know if you're one of them? Joining us now to talk about an easy way to find out quickly is Dr. Jeffrey Berman, Chairman of Cardiovascular Services at Hartford Healthcare's St. Vincent's Medical Center. Doctor, welcome.
Glad to be here.
All right, we can't see you quite yet, but let's talk about this. There you are. Hello, doctor. All right, what is calcium scoring and what does it measure? Tell us about that.
Well, the calcium score is a simple test. It's a CAT scan of the heart. Takes just a couple of minutes to do. No dyes involved. And the CAT scan detects calcium in the coronary arteries. And calcium in the coronary arteries is a marker of atherosclerosis. So if you have no plaque in the arteries, no atherosclerosis, there's no calcium. And if we see calcium, that means the patient has atherosclerosis. And there's a score that ranges from 0, which is what you want to have, up to the thousands. And anything over about 400 is pretty high risk for having significant heart artery disease.
When you see the number over 400, what do you recommend next for the patient?
So if the number's over 400, we recommend more intense evaluation. Usually it would involve a stress test as the first step, at least in a cardiology consult. And sometimes if the score is high or if the stress test is positive, it can lead to a coronary angiography or cardiac catheterization where we look directly at the heart arteries.
And the test sounds very easy. Is it quick too?
It's very quick. I was actually just speaking to a patient the other day, and the whole experience from driving up to leaving the hospital was under 15 minutes. So it's very quick, very efficient, and it gives a good indication. The problem is that the way we normally look at people with their risk factors is not very precise, and we end up not identifying a lot of the right people. So people we identify at low risk, some of them actually have high scores, and some people who we think are at high risk have no calcium and they're at very low risk.
Very interesting. All right, let's talk about some of the risk factors of heart disease.
So the risk factors we worry about most are the ones that were identified in the Framingham study, and they include a family history of heart disease, cigarette smoking, very, very important, diabetes, hypertension, and high cholesterol. Those are the main risk factors that we worry about.
Doctor, has this test been around for a long time, or is it a newly discovered tool to help people learn about their cardiac health and their risk?
It's been around. It's been around for a good 25 years, but there's been more and more studies of its effectiveness and how it can help reclassify people into either high risk or low risk based on the test. So as more data comes out, it's become evident that this is a very useful test to do.
All right, Dr. Jeffrey Berman, thank you very much for being with us. We appreciate your insight.
Thank you. It was a pleasure.